Welcome to our podcast today. I'm Maclayn.
I'm Maddie.
I'm Ella.
And I'm Claire.
Today we are going to be discussing the 5 social determinants of health. So what are the social determinants of health? The social determinants of health are the conditions in which a person lives, works, worships, and plays that has a great impact on health and quality of life. There are 5 social determinants of health, and they include economic stability, education access and stability, healthcare access and quality, neighborhood and built environment, and social community context.
The first social determinant that we will be talking about is economic stability. According to Healthy People 2030, people with steady employment are less likely to live in poverty and more likely to be healthy, but many people have trouble finding and keeping a job. For example, people with disabilities, injuries, or conditions like arthritis may be especially limited to their ability to work. In addition, many people with steady work still don't earn enough money to afford the things they need to stay healthy.
The second determinant is education, access, and stability. According to Healthy People 2030, educational access and stability are the access kids have to a good, stable education. For example, a child whose family can't afford to send them to school doesn't have an equal education to someone who has a high-income family. This can affect children's health by not allowing them to further their education beyond high school and get a safe, well-paying job. If someone doesn't have a well-paying job, it is hard to then afford healthcare and other healthy habits.
The third social determinant of health is healthcare and access quality. According to Healthy People 2030, the goal of this social determinant is to increase access to comprehensive, high-quality healthcare services. Many individuals do not get the healthcare services they need. About 1 in 10 people in the U.S. don't have health insurance, making doctor's visits quite expensive, and many cannot afford the healthcare services and medications they need. Many do not get the recommended screenings because they simply can't afford to get them done, which could cause life or death situations.
The fourth determinant is neighborhood and built environment. Where people live and work describes their neighborhood and built environment. The environment in which someone surrounds themselves heavily impacts their health. According to Healthy People 2030, some of the determinants include water, safety, and exposure to toxins. For example, living in a neighborhood with high crime or violence or living next to a meat packaging plant can be a negative determinant of health. There are things that can be promoted in our neighborhood and built environment to improve health. These things include parks for children to play, walking trails, safe housing, and access to quality and affordable food and health care.
The last determinant is social and community context. According to Healthy People 2030, social and community context refers to where a person lives and how they interact with others. This is when you receive social support from others around you. An example would be a child whose parents are in jail. It is hard to not only talk to your loved ones, but also to never receive support from them will negatively affect any child. If children have no family and support, they will start to not care about their own well-being and overall health.
Now I'm going to be talking about connecting social determinants of health into the nursing practice. According to PubMed's article, Integrating the Social Determinants of Health into Nursing Practice, social determinants of health significantly impacts patients' health by influencing disease risk, access to care, and health outcomes. Nurses must assess not only clinical symptoms but also patients' economic and social circumstances like food security, unstable housing, and lack of transportation. When social determinants of health barriers are identified, nurses can make referrals, collaborate with interprofessional teams such as social workers. They can also advocate to address health inequities, and incorporating social determinants of health into care planning demonstrates a commitment to holistic, equity-focused care and leads to better outcomes for individuals and communities.
A clinical example. A patient is a 4-year-old boy who was brought into a pediatric clinic today by his mother for worsening asthma symptoms. His presenting problems are that he has had coughing at nighttime, the risk of using his rescue inhaler frequently, and has gone to urgent care twice for shortness of breath. The social determinants of health. During the boy's assessment, the nurse asked about the living conditions the boy and his family were living in. The mother stated that they lived in an older, low-income apartment building where there is visible mold in the bathrooms and bedrooms. The apartment is also infested with mice, despite their effort to keep it clean. They have put in requests to get these things fixed, but have not yet received a response. They cannot afford to move at the moment. The impact on health. Because of the poor air quality, living conditions of the mold and infestation of mice, this has been triggering the child's asthma and is putting him at a higher risk for acute exasperation. Exasperation is the state of making something worse than it already is, such as disease, pain, or emotional state. Nursing actions. Document the environmental triggers as part of the assessment. Provide education on mitigating home allergens, washing bedding, using mattress covers, and reducing clutter. Connect the family with a social worker to work on housing assistance programs to help move them to a more clean environment and to help improve the boy's asthma. Provide resources for conditions. Collaborate with the provider on optimizing asthma management until housing is improved. Why is this an example of social determinants of health? This is demonstrating how a non-medical factor such as unsafe housing directly influences a person and their family's health outcomes, exacerbating a chronic condition and increasing healthcare utilization.
Thank you for listening to our informational podcast. I hope you enjoyed and learned a lot of new information about the social determinants of health and how they influence your daily lives.
We use ChatGPT as an outline to help create the clinical example.